I think across the country right now, there is an intense fear of providing standard of care because of these abortion restrictions. I've heard stories of patients not being provided standard of care for miscarriage management. I've heard of patients not being provided standard of care of ectopic pregnancies, which are life-threatening and are, required by our standards in medicine to treat an ectopic pregnancy as soon as it's diagnosed, because a woman can die. And is the #1 cause of death in the first trimester. And then, most concerning, there are hospitals in Florida and as well as around the country that are diagnosing complications in pregnancy and in the second trimester, things like breaking the water too early, which we call pre-viable PPROM. Those usually result in infection if not quickly treated. And now patients are not being able to be provided with the standard of care because the doctors and the hospitals have to make a decision of what is sick enough. Is just having the diagnosis of breaking your water at 19 weeks, are signs of infection sick enough, or do you have to wait until the patient has sepsis and is in the ICU and is on the brink of death to be able to provide an abortion?
So what's happening to these women?
Depends on the medical center. There are some centers that feel more strongly about calling these diagnoses threat to life and treating them sooner. And there are some that will literally wait until the woman is about to die before they will induce the pregnancy or provide an abortion. This just creates a further dichotomy in care that already existed before the overturning of Roe. That community and rural hospitals that don't have the support, that are maybe more conservative, religiously affiliated hospitals, they will literally refuse life-saving care for these patients because they don't want to be in the position of being litigated, thrown in jail for providing an abortion when really you're just saving the patient's life that we would have done, at any time prior to Roe. Then that is also overburdening the hospitals that do provide this care because, for example, in Tampa, there's one hospital that has made the decision that they will provide that care because they know that it's a life-threatening diagnosis. And so every hospital around Tampa is transferring these patients to the hospital in Tampa, and then they are now overrun with the patients who other hospitals won't take care of. And so that's really what is going to continue to happen. And that will result in women dying because a hospital might make that decision too late and someone will die before they're able to receive the care that they need.
What do you tell yourself in order to put your white coat back on and come in here again? What is the talk you kind of do for you?
Yeah, what keeps me providing care is the fact that I know that every patient that I provide an abortion for is one less patient that is at risk, one less patient that has to pay to go out of state, and one less patient that's going to be forced to give birth when they don't want to. Forced by the state, forced by, the Supreme Court of our country. And so even a simple early, medication abortion, providing that to a patient is really a life-saving treatment, and it's one less patient who is going to have to overcome substantial barriers in order to receive this care. So that's what keeps me going. And even through those hard conversations with people that we do have to send out of state, I'm then able to remember, all of the patients I did care for in that day.